11C is a resolution recognizing the need for additional trauma-informed services to address mental health, substance abuse, and homelessness in the city of Knoxville, and to express the intent of council to create an alternative response team task force to develop and propose a plan to pilot the strategic implementation of alternative response in the city of Knoxville.
Mayor, I'd actually like to suggest we have a discussion before we put a motion on the table. I just noticed in Rule 18, Order of Debate, we're able to debate without a motion.
Yeah, we have several people signed up to speak on this item. You know, and council rules, as you all know, is 3 people for and 3 people against. So let me count the number of people who've signed up so you guys know what the full number is. 1, 2, 3, 4, 13 people have signed up to speak on this. So, at the beginning of the meeting, I encouraged members who wanted to speak to select spokespeople so they could conform to council's rules. Have you all selected 3 spokespeople?
All 13.
No?
Well,
Okay. Well, council, I'll start calling them in the order in which they signed up, and after 3, we'll conclude unless there's a motion otherwise.
I'd love to go ahead and make a motion. Particularly on this issue, I've just found that folks are coming to this issue with different perspectives that I think would be useful for council to hear. Of course, I do not know who has signed up, what perspective they're bringing. But I would move to suspend our rules to allow the speakers to speak, if I have a second.
Councilmember Ryder?
well, I was just going to second, when we've done that in the past, we just adjusted the time from the 5 to the 3.
Okay, so do you want to make a substitute motion? Or?
Well, don't we need a second before I can make a substitute motion?
Unless there's not a second, and then you can just make, you can make a new
So
motion.
I'll just make I'm looking at you, Mr. Johnson.
I'll second the first motion, and then you can.
I have no idea.
Okay, Ms.
So
Parker made a motion to suspend the rules. Ms. McKenzie seconded it.
I'll make an amended motion that everyone signed up to speaks. The time limit is 3 minutes to amend our rules.
Okay, the motion to amend is setting the limit to 3 minutes instead of 5. Is there a second on the proposed amendment?
Second.
Okay, any discussion on the amendment to change it to 3 minutes? Seeing none, all those in favor of the amendment, please say aye.
Aye.
Any opposed? Okay, back to the original motion, amended to 3 minutes to suspend council's rules. And Ms. Parker, did you want to say anything else? Okay, everyone understand what you're voting on? All those in favor, please say aye.
Aye.
Any opposed? Okay, motion carries. The rules are suspended, and we'll start with Ms. Amelia James. Ms. James. Yeah. Okay, just usually we have the timer on the screen behind me, but since that's off at when there's 30 seconds left, I'll just wave my hand.
Sounds good.
And if you could start by stating your name and address for the record.
Amelia James, 1925 Ayler Ave, 37921. So I am a licensed clinical social worker here in Knoxville and a member of Knoxville Heart. So Knoxville Heart has been bringing up this idea of having an alternative response team, which are teams that pair a medic and behavioral health professional to respond to certain 911 calls in Knoxville for the past 3 years. What we've consistently heard from you all is that many of you support alternative response. You understand that the people in our city have a lot of mental health, substance use, and housing and houselessness concerns that are going unaddressed. You understand that police are overburdened when they are required to respond to calls that they don't have the proper support or training to handle. You understand that police presence can escalate someone who is already in crisis. You've also posed a lot of questions to us over the past few years on how alternative response teams would logistically function in Knoxville. And that is why I wholeheartedly support the creation of the Alternative Response Team Task Force. This task force would not exist to check some sort of symbolic box. It would be composed of key stakeholders in our community and give everyone an opportunity to come together to create a tangible proposal on how we can make alternative response a reality in our city. So in addition to my work as a mental health therapist, where I work directly with people in crisis every day, I also provide trauma-informed de-escalation trainings to businesses, social service agencies, and community advocacy groups in Knoxville. One thing I consistently hear at these trainings is, what do we do when we've used all our de-escalation skills and we still need more support, but we don't want to involve police because we know that involving police in these situations is going to increase harm? Right now, I unfortunately don't have an answer for them, but we could have an answer. We could have alternative response teams in Knoxville. Alternative response teams improve outcomes for people in crisis, free up police time to respond to other calls, and save significant money. Change can be scary and overwhelming, but I really hope that we can come together with some bravery and innovation and try something new, because this matters that much and the people in our city matter that much. We have community support for alternative response. If you see everyone here in red shirts, we have community support. We have the support of
20
Chief
seconds
Noel.
left.
And we need your support now to vote yes on creating this task force so we can take one step closer to making alternative response a reality in Knoxville and making Knoxville a safer city for everyone. Thank you.
Next person signed up to speak on this item is Alex Riffwald. You can start by stating your name and address for the record.
Hi, Alex Riffwald, 5522 Dogwood Road. Good evening, my name is Alex Riffwald and I'm part of Knoxville Heart. We've been working on this project for 3 years now. We've met with city council members, community members, neighborhood groups, the press, the mayor's administration, politicians, KPD, Chief Noel, and nonprofits in our city. We've made many connections with aligned organizations in Knoxville. Just look at this crowd. We're blown away by the support Knoxville has shown us. We've consulted with other alternative response teams about their programs, and we're in communication with activist groups across the state who, just like us, are excited about finding new ways to make our community safer. We have put in the work, and I'm really proud of us. Just a gentle reminder, y'all know about alternative response because of Knoxville Heart. We were the ones standing in front of City Council advocating for non-police response when co-response was being rolled out. Alongside our supporters, we're the ones getting this idea out into the community and making sure this conversation continues. We even coined the term alternative response teams. If you don't believe us, just Google it. Our website is the first hit on Google. So every time you use that phrase, don't forget it's because of our commitment and advocacy to this model. There's no alternative response without Knoxville Heart, and we must be included in the creation of this program. Of course, we did not invent this concept. We must acknowledge that we are here because of the incredible work of Black organizers and Black-led groups, both in this city and nationally, who are innovators in community-led safety. Lisa Edwards' death showed many white people in Knoxville for the first time that they are not immune to being harmed by policing. In the words of Fannie Lou Hamer, nobody is free until everybody is free. It feels like at this point in our journey, we all understand the importance of alternative response, we just don't know how to get there. Knoxville Heart supports a task force as a powerful first step towards our city creating an alternative response team. What we've heard from the city is there aren't resources or administrative capacity to build this program, so we're happy to do it for them. But the problem is that it's really difficult to explore potential partnerships in the community when you don't have city support or funding. A task force is a great opportunity to bring community stakeholders, experts, and impacted individuals to the table to explore how we implement this program. One thing we've learned in our research and communication with folks across the country is that public trust is vital to a successful alternative response program. We just talked to an activist last weekend who said Nashville's new model is already having trust issues because of how little transparency there was in the implementation. We cannot repeat that. A task force brings the process out of the shadows and into the sun, where we can continue our work building community support and buy-in for a program that will save lives. It won't be another useless task force. Just look at the dedication in this building right now. Please vote yes on 11C. Thank you.
Thank you. Next person signed up to speak is Ebony Winford. Ebony Winford, if you'd come to the podium. Please start by stating your name and address for the record. You'll have up to 3 minutes.
Good evening, everyone. Dr. Ebony Winford, 842H Strasburg Court, 37923. I'm speaking as a licensed psychologist as well as a director of research and health equity at a federally qualified health center here in Knoxville. I'm not speaking on behalf of that FQHC, but y'all probably know where I work. Thank you to Representative or Councilmember Tommy Smith for taking the time to meet with us last week. I'm here to speak about someone who literally does this every day. I can't give personally disclosing information, but I will share the most recent encounter I had. Pick a date, any date, because I won't give you the real date because you can identify who I'm talking about. But pick a date. A patient calls in crisis, suicidal ideation, history of self-harming behaviors with the scars on the arm to prove it, hearing voices, delusions, paranoia, and after literally 2 years of trying to convince this person to go in and get help, he says yes. Call 911 and specifically request the co-responder resource that we now have available. I am literally still waiting on them to arrive to take my patient in for care. This is not an insult to the people doing the work because I know our workforce is strained. I work in mental health. I work in community mental health. I work in primary care. The workforce is dwindling. The support is not. I understand that our hospitals are backlogged. I understand that our police officers are being asked to do roles and fulfill functions for which they have very limited training. People like me have training. We know that alternative response models reduce the necessity of that higher level of care, including inpatient admission, inpatient treatment, ER utilization. We know that alternative response models decrease low crime, anything in the city. You can look at some of the Denver Star as well as the Cahoots out of Oregon. They have data that supports that for every time we use an alternative response model, we save $400. Over time, that's a $22 million savings annually. We talking about budget, let's save some money and lives while we do it. And I'm just gonna be frank because I recognize my time is very limited. In case you didn't notice, I'm a Black woman. I'm just saying. Interactions with law enforcement are scary to me. And as someone who has to convince people who look like me to trust me enough to contact people to help them, and then the help doesn't come, or when it does come, it leads to harm and exacerbation of the symptoms that are there. We can't keep doing this, y'all. One size does not fit all. There has got to be a better, different way.
Thank you, Dr. Winfrey.
And I volunteer as tribute to be on the task force if you all approve it. Thank you so much for your time.
Thank you. Next person signed up to speak is Tina Sparks. Tina Sparks, if you could come to the podium, state your name and address for the record, and you'll have up to 3 minutes.
So my name is Tina Sparks. I used to live in Vestal. I now live in North Knoxville, 37917. I am not an expert at anything. I do not have the training that the friends who spoke before me or the friends who will speak after me have. I don't know that a lot of you have that training. So I'm asking, so that's why I'm asking, we need to listen to these folks who have the training. I do know something that I can speak to. Last week at the park meeting, and I don't think I saw a whole lot of you all there last week, but I do know two things I took away from there. Chief Noel is not here, or I would be looking right at him, making eye contact with him. Eye contact is very important when you are talking to people. I taught my kindergartners 29 years to do that. It's just good manners. Thank you. Chief Noel said two things. I wrote it down, I put it in my phone, but now I can't find it, so here it is. Two things. It is not, and I'm pretty sure I'm quoting him, feasible to have two officers in the transport wagon, the vehicle, whatever, taking friends who are in crisis to the detention center. It is not feasible. That's a real important word when you're talking about budgeting. What would make that feasible? What can you do? What can you do to make that a thing? I asked Chief Noel, what if that transport driver has a wreck on the way to the detention center? They only are allowed 2 hours to get that person to the detention center. What happens after that 2 hours is up?
30 seconds left.
The other thing that he said, and he asked in a very, and some of you who were there in the audience, you know this, he asked for donations to the police department for those things that, those machines, help me out, friends, those defibrillators, because they're expensive, and the police department, the city of Knoxville, cannot afford to have those machines.
Ms. Sparks, that concludes your 3 minutes.
I thank you for your time, and I thank you for voting, please, for Resolution 11C. Thank you.
Next person signed up to speak is Charlie Brinkley. Charlie Brinkley, if you could come to the podium, state your name and address for the record, and you'll have up to 3 minutes. Is Mr. Brinkley here? Anyone see Mr. Brinkley? All right, we'll move on to the next person, Kent Minot. Mr. Minot? Please state your name and address for the record, and you'll have up to 3 minutes.
Yeah, thanks. I'm Kent Minot. I live at 311 West Glenwood Avenue, Knoxville 37917. Good evening, Mayor and council members. I'm commenting in support of Alternative Response Team Task Force. Would be tasked with developing a pilot program to implement Alternative Response Team in Knoxville. Alternative Response is actually pro-police. Cahoots, an alternative response program in Eugene, Oregon, responds to 17% of Eugene Police Department's overall calls. Albany Law School found the city saved an average of $400 each time that Cahoots was dispatched instead of police, resulting in estimated annual savings of over $22 million. It's a small city, not bad, huh? The key point here is that the Eugene Police Department likes the program, reducing the number of instances in which police are called to assist Eugene's unhoused population, reduces the number of calls for which their skill set is a poor match. Crisis workers are able to successfully and safely respond to nonviolent calls. Our police department is currently understaffed. Alternative response would allow existing staff to cover more of the calls for which police are properly suited. On October 2020, LA's City Council voted unanimously to develop a cahoots-like program of unarmed crisis responders. I think our own police chief says that it is possible here. A Stanford University study found that Denver's alternative response program resulted in a 34% drop in low-level crimes. Let's make Knoxville safer and freer from crime and kinder. Thank you for your kind attention.
Thank you. The next person signed up to speak is Sam Armbruster. Mr. Armbruster, you could come to the podium, state your name and address for the record, and you'll have up to 3 minutes.
Good evening. My name is Sam Armbruster, 2700 Parkview Avenue, 37914. I'm speaking as someone who has lived and worked in Knoxville for the past 6 years. I've worked in community mental health, actually alongside Ebony. I've worked in harm reduction, and during that time, I've built relationships with lots of organizations, and more importantly, lots of people living in our community who have been deeply impacted by houselessness, by the ongoing housing crisis, the ongoing overdose crisis. And one thing that I've realized over that time is that we need more tools in our toolbox. And I think that alternative response is a really essential tool that we could easily add, and that supporting 11C would give the opportunity to figure out what that could look like in our community. One example that is really close to my heart and the work that I have done over the past 6 years is thinking about the ways that the overdose crisis has impacted our community. I know from the work that I do that the vast majority of people who respond to overdose are not police officers. It's people who are in community with other folks who use drugs. They're reversing overdoses of loved ones, of friends, of the people that they really care about. And that is something that's deeply, deeply traumatic, both for the person who is overdosing and for the person who's reversing that overdose. And so many of those people, after the overdose is reversed, choose not to seek emergency services out of fear that the person who reversed the overdose or the person who was overdosing or anyone who's present is going to be arrested for something like paraphernalia charges or a warrant or something like that. And we all know that arrest is not going to make the life of someone who just effectively died and came back better. But what if we
30 seconds.
What if we imagine a world where someone can come and help them process that trauma and help them make sure that they're physically okay and get them the support that they need? I think that's a world I want to live in, and I think we have a really easy tool that we can employ to make that happen for Knoxville. Thanks.
Thank you. Next person signed up to speak is Elizabeth Johnson. If you could start by stating your name and address for the record, you'll have up to 3 minutes.
Hi, good evening. My name is Elizabeth Johnson. I live at 1330 Granger Avenue in Knoxville, 37917. And I, like others, am here tonight to express my support for Resolution 11C and to urge you to allocate funding to an alternative response team task force. Alternative response teams safely and effectively redirect vulnerable individuals away from the criminal legal system and towards the social services that they need. Alternative response teams can help prevent escalation, improve outcomes for individuals experiencing mental health crises, contribute to more equitable outcomes for people of color and others that are disproportionately impacted by the criminal legal system, and save cities money. Alternative response teams also reduce the burden, as others have noted, on law enforcement and traditional first responders. As Chief Noel recently noted on a panel at UT College of Law, most of the calls that KPD responds to are not violent crimes and sometimes aren't even crimes at all. So when alternative response teams can, so in some of these situations, alternative response teams can be dispatched instead. So when a parent is struggling with their child and desperate for help, or a daughter is worried about a parent's mental health, or a grandparent is concerned about a grandchild overdosing, or a resident is worried about the safety of a person who's pacing up and down their street and is very obviously experiencing a mental health crisis, a trained behavioral specialist and medical professional, rather than a law enforcement officer, can respond. As you continue to deliberate tonight, I hope that each of you will think about what you would want if you or a family member or a friend or a neighbor were experiencing an acute mental health or substance use crisis. Who would you call? Who would you want to respond? And what would you need in that moment of crisis? I know what I've wanted when I've been in some of the situations that I've just described. And as a researcher who's been studying how contact with the criminal legal system affects children and families for more than 2 decades, I also know what the data say. It's time for us to expand how we think about safety and how we respond to people in crisis in our city.
30 seconds.
Providing funding for an alternative response team task force is an essential first step, and I hope that you vote to approve Resolution 11C. It's a safety issue, it's an equity issue, and it's an economic issue. Thank you.
The next person signed up to speak is Tyler Givens. Mr. Givens?
Hi, my name is Tyler Givens. I live in North Knoxville. City council members and mayor, you've heard the voice of the people here tonight. Look at this diverse crowd of faces and voices that want to do better for our people that are facing crisis in our city. You've heard convincing arguments, expert opinions, lived experience, and the hopes of our community. Please support this resolution. Thank you.
The next person is Brady Watson.
Hello, Brady Watson. I live in North Knoxville. I too, I'm no expert. I don't have a whole lot else to add. I will say I think the folks you need for this task force are in this room. You have a lot of brilliant, really experienced people here. I don't believe the resolution actually names who will be on the task force, but again, I encourage you to look for the folks in this room. You have the data. They know the data. They know how this can happen. I think what I really want to stress is that hopefully when you pass this resolution and create this task force, and once 8 months is up and they have a recommendation to implement a pilot program, you actually do it. We know we need this. People are suffering because we don't have this model. It's worked elsewhere. It can work here. So again, I just encourage you to pass this resolution and 8 months down the road to actually implement what the team develops. We know it can work. We know we need it. KPD has said we could do it. One of the officers from the Lisa Edwards case said some things I didn't agree with, but he did say that he never should have been there, and I agree with that. And so, again, please vote for this, and please make this happen. Thank you.
Next person signed up to speak is Hassan Atachan. You have up to 3 minutes.
My name is Hassan. I'm a lifelong South Knoxvillian. As we face unprecedented challenges, increasing overdoses, houselessness, displacement, addiction, mental illness, suicides, death by gun violence, and the confluence of these factors at once, our people deserve policies, programs, and funds that reflect the needs of our communities and that show us that you take our losses, our pain, our trauma, our lives, and death seriously. I, along with several community orgs that together represent thousands of Knoxvillians, ask for the establishment and funding of an alternative response team here in Knoxville as our biggest priority. Funding an alternative response team has for years been a community priority. After Ant was killed by KPD in his high school bathroom with no attempt to de-escalate, to talk to him, to listen to him, to love him, to call his mama, to support him, we asked if we would have to witness another preventable tragedy before our city was willing to act. With the preventable death of Lisa Edwards, we've now experienced the loss so many of us warned our city about. At the hands of KPD, we've yet again lost someone who would still be with us had an alternative response team existed and responded with love and compassion to Miss Lisa's pleas for help before she was taken from her family and community. Not only would funding an alternative response team prevent unnecessary death and minimize at-risk communities' contact with the legal system, but it would also ensure that KPD is not forced to engage with people who just need support and that they acknowledge they are not trained or equipped to support. There is no question that an alternative response team should be established and funded in this year's budget. As we experience a housing crisis, a pandemic, inflation, increasing desperation, addiction, and mental illness, there's a dire need for the compassion and care we have seen shown by alternative response teams that have been established across this country. Houseless people and mentally ill people deserve bodily autonomy, and forcibly displacing and incarcerating the poorest and most neglected members of our community is a tragic injustice that has shocked many of us in Knoxville these past years. Our people, poor people, deserve support, love, and compassionate responses rather than additional trauma and harm. Rather than rounding up and displacing and incarcerating our city's most vulnerable members, those who suffer from severe mental illness, substance abuse disorders, and chronic poverty, we must invest in supporting our houseless community and people suffering from these hardships to make sure that poverty does not continue to be a death sentence or cause for incarceration for people who have long been abandoned by our leaders. 1 out of every 3 houseless men in this country is a veteran. 22 veterans commit suicide every day,
30 seconds.
Most of whom are traumatized and suffering from PTSD and other mental illnesses. My dear friend and South Knoxvillian Josh Evans is among those veterans, lost to suicide in a jail cell after a violent arrest during crisis, a mental health crisis. I think often about how he would still be with us if an alternative response team had responded to his crisis with compassion and care, rather than violently arresting him, jailing him, and ignoring him in his desperation until they found his lifeless body in that jail cell. To our elected leaders, if it were your babies, your elders, your families, your mothers who were preventably killed, lost, humiliated, mocked, as they breathe their final breaths.
That's been 3 minutes.
How far would you go to make sure that policies were put in place to make sure that such loss did not happen again?
Next person signed up to speak is Evora Price. Please.
Hello, my name is Evra Kreis. I live in South Knoxville. I'm here today in support of Resolution 11C for an alternative response team for mental health crises. For over a year and a half in 2021 and 22, I worked at the Mobile Crisis Unit at Helen Ross McNabb as a transport and triage worker. When folks would call the crisis number for mental health care in Knox County and surrounding counties, I was one of the people answering those calls. My coworkers and I would always try to refer people to the least intrusive resources for care possible, but when someone was in danger to themselves or others due to suicidal ideation, homicidal ideation, or psychosis, and the person would not get help voluntarily, the only resources we had to offer was a safety check, which meant getting the police involved. In the best case, we could call co-response, but unfortunately the team had very little capacity and of course involved officer response. The response I heard from clients and loved ones was overwhelmingly that they would prefer having a social worker respond to these crises. but oftentimes people would decline getting the help they need for them or their loved ones that they really needed because of the potential presence of law enforcement. I heard from many folks that they were afraid for their safety and had previous trauma surrounding police encounters. Everyone deserves safety and care in a crisis without fear of being harmed or incarcerated. And I and many others in our community want that for the people of Knoxville. As you can see from the beautiful people behind me wearing red, many people support this. And in the interest of better client and community care in our city, I urge you to pass the resolution 11C for an alternative response team. Thank you.
Next person signed up to speak is Constance Every. Miss Every. You have up to 3 minutes.
Constance Every, Knoxville, Tennessee, 37914. Hey, Knoxville voters. So India needs to pass this resolution because she has nothing to bring to the table for her 4.5 years as the mayor of this city. Let's also keep it realistic. We have been here before. This is a second attempt to bring heart across the table after you all rejected it 3 years ago, as someone highlighted, for this watered-down version called Responder Program instead. And now that that has literally blown up in your face by the data of success, or more importantly, failure rate, you are ready to now try something truly different. But give Hart the credit for their resiliency and determination. More importantly, the ability to change the key piece, which is an elected employee versus an elected official. Shout out to Amelia Parker for not letting this initiative go and still doing the due diligent work to bring it back to the table a second time around. You all have to pass this resolution because we have already highlighted before, Anthony Thompson Jr. needed this program. Lisa Edwards needed this program. Sierra McCullough needed this program. There are so many numerous others. And so we cannot continue to sit back and funnel money into our police department that we have spent more time giving militarization and surplus equipment to versus actually addressing the cultural issues within the department itself. So again, voters, if they do not give you what you need tonight, then you leverage the vote and vote India and the rest of the administration up out of here. You have the power, you have the say-so, exercise your authority, exercise your leverage, and more importantly, vote India up out of here because she continues to show who she truly is. I cannot say it enough. If you are not voting for Constance Every, then you are not serious about change. If you are not voting for Constance Every, then you're not serious about heart. If you're not voting for Constance Every, then you're not serious about the KPD Police Department and the necessary changes that must come through once for all. Again, Knoxville, we need this program. And if they don't give it to you, then you use your ultimate power as a voter and as a taxpayer, and you put these people out of office once and for all. I yield my time.
Council members, that concludes the people who signed up to speak to item 11C. Councilmember Parker?
Thank you, Mayor.
Ms. Shipe, I have you signed up as for public forum. Okay, council, apparently.
We already have.
Council members, unless there's any objection, Ms. Shipe says she meant to sign up for this item, not public forum, correct? Okay, come on down.
Good evening, Vivian Shipe, 3615 MLK, Knoxville 37914. The phone rings. In that unseen space between the parent and the child, the sounds of a scuffle ensue. The child is phasing. They're having a psychotic moment and they're scared. Scared because somewhere in their confusion is the warning that those uniforms mean something is wrong. What's going on? What has happened? Why are they surrounding me? They don't know how to react. They don't know what to do. Those voices of authority seem very loud. Miles away, over the airways, the mother can hear the conversation, the orders, the scuffle, the demands to get on the ground. In the midst of all this, in the midst of the handcuffing, the placing in the police car, the parent hears the child say, "I'm not a bad person, officer. I'm not a bad person." Then the phone goes silent. How different this scene could have been. What if the person in that moment of crisis had first been met by two people in a van or an SUV, in polo shirts and jeans, people trained to talk down a person suffering from the disease of mental illness and able to get them to a point where they can be taken to the Behavioral Health Urgent Care Center for evaluation and stabilization, with the choice of either hospitalization or housing waiting to take them to a restorative place. Not to MedPod 4 at a jail whose purpose was never meant to care for the mentally ill. Housing, that is the other missing piece. You see, we've talked about it for far too long. We must put dollars, real dollars, behind housing that provides safe spaces with wraparound services. We must deal with mental illness just like we do other diseases, for it truly is just a disease of the brain. What is being asked for tonight is doable. It is critical. It is past time. It is needed right now. There is a saying, where your money is, that's where your heart is. Where does the heart of the people of Knoxville lie? As you look around this room and read the emails that you have received, you can see it lies with the most vulnerable. It lies with the least of us. I would remind you of the words of the book you put your hand on when you were sworn into office. Matthew 25:40. The king will answer and say to them, "To the extent that you did it for one of these brothers of mine, you did it for me." Tonight, approve the resolution for an alternative task force. Place it in the budget and let it become a recurring part of our yearly budget. Tonight, do it for the most vulnerable of us.
Thank you. Councilmember Parker.
Thank you, Mayor, and thank you so much for the community who showed up tonight, who've been working hard on this issue, who signed up for public forum. We are here tonight discussing this issue because of all the work that you have done. So I just wanted to say thank you quickly to the mayor and my colleagues. I wanted to begin today's discussion a little bit different than we had in the past, because I know members of council have been having conversations with members of the community about this topic, and I'm quite excited about where we are in that conversation. I believe there's a lot of support for this resolution, but I also believe there may be need for more time for council members to grow in their understanding of what exactly is being proposed. So I wanted to hear from council members tonight. I can start off briefly by introducing the topic and stating my reasoning for wanting to bring the resolution. I think many of y'all are aware that members of the community held a People's State of the City address recently this month to highlight some issues that they felt needed more attention from city government, more attention in our budget. And some of those issues are priorities that city council cannot move on. You know, we are not able to decouple the Title VI office and the Community Safety Office. We do not have power over those things. But the issue of alternative response is something that we could have some impact on. And through conversations with the community, it was only 20 days ago, May 10th, that the community met to formalize a proposal to move alternative response forward. And initially, the proposal was to fund and to present a resolution that fully funded an alternative response team, not just the task force, but the full team. And after conversations, it was clear that the council is not ready at this point to commit to the team to that level. But there may be a possibility for council to approve this resolution and commit to forming a task force. So if you all would be open to it, I would love to hear where everyone is at with this resolution and your suggestion of whether you're ready to vote tonight or if you need more time. That's what I propose.
Councilmember Singh?
I'll go. I think it's time for this, guys. We've been talking about it for a really long time. The volunteers that have been involved in this for 3 years, they put a lot of time and energy. They're not getting paid. They're doing this for the community. We've had a lot of instances where an alternative response team would have been appropriate. I agree with one of the speakers. This is pro-police. We ask our police to do a ridiculous amount of social work. That is not their job. I do not think we need to workshop on this anymore. I do not think we need to wait until the county and the health department and everybody else gets involved. I think this is our responsibility. This is something that all over the country is happening. It's not brand new. And I'm surprised that we have any resistance. I understand that there is not a group who has, like McNabb Center, stood up to do the co-response model, and we don't have that right now for an alternative response. But we need to create that, right? We created Turn Up Knox when we were missing, when there was a gap that needed to be filled. I think the $50,000 is a very small amount to start moving forward on this. Thank you.
Thank you. Councilmember Brito?
Thank you, Mayor. I'm very supportive of considering this addition of alternative response to further complement our efforts that we've been doing about responding in instances where, a police response and police presence may not be necessary. So I'm very supportive of all the work that's going on. For those in the room, I know council knows this, but 2 years ago at our council retreat, council asked to have a joint mental health care workshop with our county and state partners, and we did that. And so about a year ago, we had that, and since then, I've continued that discussion and actually been continuing discussing alternative response teams with the providers that we have in the community. I've also asked for a review of gaps in services that an alternative response team could fill. To the question of this resolution today, I don't support the language that's written because, I'm not sure that $50,000 is the right number. And in my experience, knowing how we've had some successful task force in the past, they can sometimes get things done. The most recent example is the sign ordinance task force. They met for 3 years before they brought somebody to council. And I agree with what everyone said. This is so important. It's not something that needs to just go to a committee. It's something that we need to work on. So that's why I don't support the task force at this time. I do have some questions, though. Deputy to the Mayor Gill, has city staff researched this model?
Thank you, Vice Mayor. Erin Gill, Deputy to the Mayor and Chief Policy Officer. Yes, we really, in response to many of the public comments that some of you made when we were on Zoom back in 2020, our team, and Ms. Middlebrook was part of this as well, began to look at alternative response, and we looked at case studies, we looked at third-party research, we spoke with local providers, potential partners, and we also had conference calls with some of the cities that are successfully implementing these programs. So we did, if you recall, present some of those findings in a workshop in June of 2021, and really as a result of some of that dialogue, contracted with McNabb to provide a workshop for sequential intercept mapping that many partners in our community participated in, and alternative response was considered as part of that sequential intercept mapping process.
Okay. And in your review of alternative response teams, has this approach shown promise in other communities?
Yes, it has, and I would say that, you know, as folks have articulated both in meetings and as you've heard our team say in conversations about this, we do think that they have shown progress, or excuse me, promise, and could, in theory, work in Knoxville. We see that as a potential to explore.
Okay. Now, the city doesn't have a health department, and we don't have specific expertise in mental health. Is this something that could work in Knoxville if we found a local partner who's willing to operate it?
We think that local partner would be absolutely critical.
And in looking at these kinds of programs that you've looked at, what are the more successful ones that you've seen?
So I'll hit on some of the themes that we've seen that make them successful. The first is really a foundation of cross-jurisdictional partnership. So it's not just a city acting unilaterally, but having strong partnership, including funding from multiple sources. That includes county, state, federal, kind of all the way up the chain, as well as philanthropic. We've also seen that they're complex, so they require really extensive coordination to manage those highly complex logistical systems to make something like this successful. And one point is that they also require significant new funding, so it's not necessarily realistic that they are offset by savings elsewhere.
Okay. And so is there a benefit to having a cross-jurisdictional approach where you've got the city, the county, and the state all at once working on something like this?
I think particularly because it is so predicated on mental health as the key focus of the service, then yes, it would absolutely in Knoxville require that type of cross-jurisdictional partnership to be successful.
Okay. And what I would pose to council as well, and I have brought this up with our planning commission chair, is maybe we should reconvene the joint mental health care workshop, and we can discuss those gaps and potentially this as well. So I just wanted to put that out there that we could do that today. We could think about that going forward. And then, Mayor, just my last question. This is asking for $50,000. Would you support and bring a budget amendment if a partner could be found that could stand up this type of a program and funding from other partners was located?
Yes, absolutely. I think that'd be a really positive step forward, but I think those other partners are essential.
Thank you.
Councilmember Testerman?
Thank you. I just have a question. I don't know who is equipped to answer this, Councilmember Parker or someone else, but I'm just curious, after having looked at different models across the country, and we have heard about it for a long time, I'm just curious what analysis has been done that, looking at Knoxville, I don't know if call volume, those types of things have been considered, but how much this startup would cost? How many individuals would you anticipate would also need to be hired to form an effective alternative response team? For starters, that's my first question.
Yes, I would say that initial work has been conducted in multiple spaces to different degrees. As far as the Knoxville Heart Group, they have a proposal for an initial startup that would require the purchase of a new vehicle, hiring 3 staff people to start up the program. I think the budget's close to $400,000, around $350,000 would be a startup cost for a pilot program.
Okay. I just go back to our current co-responder model, and we've got, 4 teams, I believe, that, has started. And, I know that that's nowhere close to it being fully functional. It would probably take 18 to 24 individuals to be able to fully staff all shifts throughout the day. And the cost associated with that would be pretty costly. And then my concern in this model, the fact that nurses are a part of this equation, knowing how healthcare is struggling with nurses and are depending on traveling nurses to be able to staff our hospitals and our emergency rooms. Our ambulance, our responders are part of this equation. And to be very honest, I mean, our ambulance system right now is incredibly broken. I mean, there are 4-hour response times, 7-hour response times, 8-hour response times. So, you know, we have so many broken pieces already that this program would be dependent on. I just am you know, would even be concerned on how that staffing would even be possible at this point, not to mention the cost that would need to be allocated.
Can I make one clarification?
Okay, yeah, or please be quiet in the audience. This is a discussion among
Yeah.
council members. Councilmember Tessman, did you have anything else to add?
I'll let Councilmember Parker respond.
Ms. Parker?
I just wanted to offer one clarification. I've actually met with multiple EMTs who are in support of this program. I almost said super support, but I'm trying to be professional. In support of this program. And part of the reason is because of the state of our ambulatory care and emergency room capacity. They see this as something that would relieve the workload that they're currently experiencing as emergency medical staff. And I know that they would love to be a part of this process, a part of the task force, a part of developing that solution. But I just wanted to clarify that those are pieces that hopefully this program would relieve some of the work rather than needing them to be a part of the equation in that sense.
Thank you. Councilmember McKenzie and then Ryder.
Thank you, Mayor. So I want to first say that I am not opposed whatsoever to alternative response teams. But if we're going to do it, we have got to take a lot of things into consideration. One, for example, when we talk about ERs and how understaffed they are and overpopulated. When you walk in UT hospital emergency room, most nights it looks like a third world country. Some nights in there are people who are literally sitting in the lobby who need to be back being cared for, and they're out there with IVs and all types of things. That's not a good level of care, if you will. But when we talk about alternative response teams, when we have someone who is suicidal or homicidal ideation, someone who is high on drugs, 9 times out of 10 before a family is going to call anybody, they've been experiencing this for a very long time. And a lot of times it is to the point where they can no longer handle it. There's aggressiveness, they are afraid, there is some violence toward family members. And so I'll go back to the joint workshop that we had, if any of you guys watched that or you were here for that. And to be honest with you, there is no way that we are going to be successful because we all know, and those of you who are sitting in the audience, the treatment options are very limited. There are waiting lists that are ridiculous for people to get help. So even when we go out on a call, even when you go out on a call, where are you going to put the person? The most disgusting thing that I heard in that joint workshop, and it was a true fact, from the Knox County Jail System, it was Randy Nichols who said, Knox County Jails is the mental health facility for people in the city and the county. And that's horrendous because that is not where they belong. That is not where they belong. But there are no treatment options that are available for some people who are in those levels of crisis once they are medically stabilized. And that's where they end up, if they're medically stable. That is not the place for them. So a joint venture needs to look like city, county, and the state. It has to be sustainable.
Hey, please be quiet. We can't hear Ms. McKenzie.
Again, for it to be sustainable, It has to be a joint venture on all levels of government bodies. We need the state stepping up to be able to invest more dollars into putting state-level mental health and substance abuse facilities back into our city. Again, I'm speaking. So at this point, when we're talking about a task force, when we're talking about something of this nature, all of those entities have to be at the table. There is no way around it. All of these entities have to be at the table. That's Helen Ross McNabb, that's Cherokee, that's everybody. So again, and I'm speaking. If you want to have a conversation after the meeting, I'll be happy to speak with you. But again, in order for us to be able to deliver the type of services to meet the needs of the people who are living in our city and our county, this is so much bigger than just the city. And if we're going to do it, we need to do it right. And so that's my position on it. Not opposed to it, but we are going to have everybody at the table. And again, when I say joint venture, we cannot just continue to look to the city. The city cannot do it alone. We don't have the capacity as it relates to the mental health facilities, the substance abuse facilities. There's so much dual diagnosis that's going on as it relates to some of these issues that we're talking about. And so I appreciate the work that HEART has been doing, but there is so much more support that it will be needed outside of the city to make this successful.
Thank you, Councilmember McKenzie. Councilmember Ryder. Members of the audience, please do not interrupt City Council. This is their time to have a discussion. Thank you. Councilmember Ryder.
Yeah, so Councilwoman Parker specifically asked for this time for us to have a discussion, so I appreciate that. When I spoke with a member from HEART, my reservation was about the $500,000 that was in the resolution. The number that actually made it to the agenda is a different number. So my questions to Ms. Riffwald, I believe, were what is the $500,000? Like, what is the budget? There was no budget to that, and so that was the hesitation. I don't think that any of us are opposed to have an alternative response. I think the struggle is that we started, and many of you have been in it for the long haul, we started with the co-responder model because the social workers that were willing to step up in the staffing program said that their staff didn't want to go out without backup in the instance when things might go a different direction. And the struggle that we have right now is not that that model is failing. It's not someone said not a one-size-fits-all. It's not a one-size-fits-all. Some cities have both models. Is that those positions are vacant, and Helen Ross McNabb has many vacant positions as well. I just think it's important to say that many of us in the room, though we think we don't agree with each other, we do. We're in a state that has not taken the Medicaid expansion, and that we have a collapsing healthcare system, and cities like Knoxville and Nashville and Memphis and Chattanooga that actually still have hospitals, unlike the many places that don't have hospitals or ERs, we're collapsing because we're bearing the brunt of all the places that don't. And we have a lot of caregivers that don't want to be in this state anymore, let's be honest. Why would they? People have made it unpalatable to be here if you're a caregiver, and so that's cascading and making things that weren't great worse. So I'm not opposed to having a task force. I have a question for Ms. Gill. So we're doing the joint state, county, city funded, I'm not sure what we're calling it, in the old.
Empath?
Empath? What does that stand for?
At St. Mary's is what you're talking about?
Yeah, what are you calling it, empath?
Empath, does that stand for?
Okay, and so what exactly are we going to be doing there, and is that expansion and some of that funding and or something that could be added upon to address this?
Councilman Ryder, I'll give the overview from my understanding and ask my deputies to expand if for anything I may leave out. But basically, this is a good example of how the city can contribute to mental health. We own a building at the corner of St. Mary's that used to be the Women's Outpatient Surgical Center. Is that right? Or some outpatient surgery, and it's vacant. So we own it. We have a building. We have needs in the community. So we went to the state. We met with the governor. We went with Mayor Jacobs. We explained the need, that we need more mental health inpatient care and short-term care. And what we could offer is a building and money to commit to renovate that building for the new need. And the county said they would agree to help us with the renovation costs. So there's money in real estate from the city. And what the state agreed to do, along with the hospitals and McNabb, is for the hospitals to staff an urgent care clinic in one part of the building, and then another part of the building is going to be, I think, 17 short-term beds for people in a mental health crisis, up to 3 days. So there'd be a physical health clinic in one portion of the building for the general public, for strep throat, sprained ankles, or to get medically cleared to get admitted to the behavioral health unit. So basically it's short-term beds, I think 17, and that it will be funded, and this is important for council, mental health care is expensive, and staffing it is expensive. McNabb will staff it, and it'll be funded in part through hospitals and TennCare, I believe, the staffing. Mr. Brace, can you elaborate on things I might have left out?
No, I think what's important about that is that was an initiative pushed by the three big healthcare systems, University of Tennessee, Tennova, and Covenant, specifically Fort Sanders, which sees significant amounts of indigent care. And so we came to the table to support this initiative through the healthcare systems and McNabb, and again, provided the building, some initial capital along with the county, and then the funding will come primarily from the state, and some, I believe, indigent care from Knox County. But again, that took 3 years of work, and again, we were at the table to help with that, but the leaders were the healthcare systems and McNabb.
My time is up.
Okay.
Come back.
Council Member Singh.
Thank you, Mayor. There have been a lot of concerns and issues raised, legitimate and good ones, and we've talked about what resources we don't have. I think these are all the things that the task force would be working on as a council. As a council, that is, most of us, that is not our skill set. And I don't think we go into other programs to this extent to review them. The objection or the hesitation some folks have on the task force, we created the African American Equity Restoration Task Force, and I believe that was funded $150,000. And I believe that it was necessary, and it's doing good work. But this is an example we've used before, and it's moving forward. And yeah,
Thank you. Councilmember Parker?
Thank you, Mayor. I wanted to share a quick story about my trip to Denver. I was able to meet with Denver STAR, their alternative response program. And, you're in Denver, they've got this great public transit, you're looking around, and they have more resources than Knoxville does. So top of mind for me was, I asked them, if you did not have the services in your city that you currently have, and you didn't have as many options to take someone to a service provider, if you didn't have expanded Medicaid, would this program still be beneficial? Would you still recommend a city like Knoxville implement a program like alternative response? And they emphatically said yes. And they gave specific reasons why and examples. And a lot of the times it's because they can treat someone, stabilize someone right there where they meet them. They don't have to take them somewhere. They don't have to use the emergency rooms. It actually frees up space in our emergency rooms because there's this alternative option. But they emphatically said yes because of the experiences that they've been having since their program was started, another set of phone calls that they get that they're able to respond to are folks, experiencing a low level of mental health crisis where they're living in a more isolated situation. They just don't have anyone to turn to. They would call Denver Star, who could come and talk to them through whatever small crisis. It doesn't have to be a major crisis. It can even be a small mental health crisis that Denver Star shows up for. And they were able to respond in this way, particularly during the pandemic when folks were in isolation. We still have folks who are living somewhat in isolation if they have fragile, a medical situation. They're still susceptible to COVID and other diseases out there. So I still see that as a need in that situation, as well as these situations where they're able to treat folks in the field. The other thing I wanted to say is I agree that this has to include as many partners as possible and all levels of government as possible. I would love the federal government to be a part of this task force. But to get the state involved, it's not going to be Knoxville Heart that pulls them in. It's not going to be Councilmember Parker who pulls them in. We really need the support of the administration to pull the state into these conversations. And so, the purpose of the task force is just an initial step for us to say, the city of Knoxville is interested, the city of Knoxville sees this as a need. We do not believe we can do this alone. We believe that we will need partners in different levels of government. We will need partners in nonprofits, in the private sector. But the task force provides the space for us to pull people into this conversation and see what results from it. I also hear concerns about the 8-month timeline and how long other task forces have taken to produce a proposal. I do think that we can extend that. I think it's helpful to set an expectation. This was set by the community of the timeline that they wanted to work within to show what their level of commitment was, what future, members of the task force, what level of commitment we need from them so that we can really engage in a high level of work for several months to bring back a proposal. But if more time is needed, that can come back before council to consider an extension, additional funding, but hopefully work could be accomplished and this could move us forward in the amount of time described in this resolution.
Thank you. Councilmember Ryder.
Yeah, so my question a while ago to the administration wasn't precisely exactly what empath was. It was, so the question here is who houses the alternative response team? And that's the question that Hart has been asking. And the response is collectively, KPD is not where it belongs, or an alternative response. So my question is the alternative response team, is that something that can be housed with the empath offered and managed through Helen Ross McNabb? That is my question.
I would just say that McNabb has been part of these discussions for several years, and they say they want to focus on co-responder and the many other things they're doing on mental health, and they are not ready to embark on an alternative response. So, and they are the ones that, there was one of the speakers who talked about, the mobile crisis service. They are our mobile crisis service through the mental health department. We have a state of Tennessee mental health department, and here's, it says that there's a 24/7, 365 response team for those who are experiencing a mental health emergency. And then they say the services are for children and youth, adults, across the state. The problem is, and we all know this, is that it's not enough. And they need to, do a better job providing those services in person, not just on the phone and not just during business hours and so forth. So Again, I think that this is really important. I think the city can play a role, but just like Empath, which we started, Empath and the BHUC and street outreach workers, all these things that the council has pushed for and supported that we did, we moved forward on those just as a council because we heard input from the community. They didn't need a task force. And so this is the state responsibility, and I agree with Councilmember McKenzie and others who've said that we should definitely play a role in this, but it can't be something that we are starting like our own city mental health department. I think that that's outside our purview, it's outside our budget, it's outside our area of expertise.
To fund the baseball stadium.
Council members Singh.
Thank you again. I don't think anyone's talking about funding an entire mental health department right now. And Lauren, I think you asked some really good questions. Once again, I think those are things that the task force needs to look at. I don't have much hope that the state of Tennessee is going to come out here, or the sheriff's department. They're too busy fighting with kids, with 15-year-old girls. But I do not think that they are going to be. If we don't do this, what are we going to do, right? I'm still very sore about 2 weeks ago when the recovery community lost out on $5.5 million. And then now today, we're talking about not helping other people who are in crisis. And I'm just really disappointed that we're not moving forward somehow. I do not want to sit here and go, yeah, this is a great idea. Let's wait for other people to come in and do this. And then 3 years later, we're having the same conversation. So what are we going to do if we don't do this? What's our next move?
Councilmember Parker.
I agree with Councilmember Singh, and am worried that we're struggling to see the benefit of something that many of us feel is a reasonable next step in this conversation. I do think that the task force is the space for us to explore these questions, and council meetings have not been adequate. Workshops have not really been adequate. Oftentimes workshops are an opportunity for information to be shared with us, but we don't have as much opportunity to have discussions like we're having right now and like a task force would engage in. We've definitely heard from Helen Ross McNabb that they are interested in the co-responder model, not necessarily housing an alternative response program. And so I think that is another reason why the task force is needed, so that these mental health care professionals from other agencies have an opportunity to help develop a plan that expands what our capacity is as a city beyond what Helen Ross McNabb is able to provide. Completely understandable if they want to, limit their services. Absolutely, completely understandable. But what is not okay for me is that we say this is the state's responsibility and we continue to send police to situations.
That's right.
We are obviously taking on the responsibility if we are sending police. We're not going to step back and say, hey, state, send some police to that issue. We're the city. We don't deal with mental health. We're not going to let that happen. We have a duty to our citizens to ensure public health and safety in our city. And so whether the state provides the funding, whether the state provides leadership on this issue or not, the problems fall back to us. And so we have to have a solution. And to do nothing means that we're just going to do the same thing, which our community is telling us is causing harm. I really hope that, we're able to find a solution that we're able to move forward. And if that means, you know, a few edits to the resolution, please let us know, because this is our space to have some debate and negotiation and see if we can come up with a solution.
Councilmember Testerman?
Thank you. So I'm just curious if, let's say, the task force is formed. Help me understand what that looks like, the structure of it. You know, how many members are there? Who's going to oversee scheduling meetings? You know, noticing.
Hey, please do not interrupt
Shut up,
the discussion
Constance.
of council, or you'll be asked to leave. Hey, order. If you cannot keep silent during council's discussion, you'll be asked to leave. Does everyone understand? If you cannot keep silent and let council conduct their business without interruption, you will be asked to leave. Councilmember Testerman.
So I'm asking a legit question. If you've got a task force that's formed, whether it's a committee, a board, task force, whatever, it's got to have structure. So I'm just curious what's been thought out where that's concerned. Again, how many members, scheduling, keeping minutes, sunshine notices, all of those things. You know, I just go back to, you know, a business plan of some kind of the task force, but also the model for an alternative response team, you know, who oversees it. We've talked a whole lot about Helen Ross tonight, and nobody's here representing them to be a part of this conversation. So these are all just questions that I have. It's like starting any operation, any business, to better understand the confines of what that looks like.
No, happy to answer. The resolution is written in a way where the task force would be formed 2 months from now, if passed today. And so that would give us 2 months to finalize all of those details. I would, you know, commit to engaging in the process similar to what we've seen over the last few days, where, you know, leaders in our community who are leading on this issue are in touch with council members to gauge your input, solicit your input on what that makeup of the task force should look like and what you would support, because the makeup of the task force would come right back before City Council for approval. I have meetings with the administration to get the administration's input on members for that task force, but that would be work to be conducted after this resolution passes over the next 2 months before it comes back to City Council.
Thank you for that. I just, you know, again, going into something of this magnitude and having some of those things already thought out and fleshed out as to what it looks like, just even a rough draft, if you will. I mean, I think that's, you know, the idea, but I guess I'm just looking for more details on what's been thought through.
Well, and just quickly, I guess the rough draft would be the description in our packet, you know, that states the type of members that we envision would be a part of the task force, what demographic they're representing. Where is that? I have it somewhere. And that's on page 594. That describes a bit of that demographic that we would expect to be represented on the task force. So that's a little bit.
I'm sorry, Councilmember Smith?
Thank you, Mayor. I've tried to, spend a lot of time on the phone with folks from HART, people at McNabb, and members of the administration. So I just want to reflect a little bit about what I've heard. I want to first of all thank HART for bringing this model to me years ago, and you all brought educated, rational, programmatic ideas for this program. And I think what I've witnessed is over the course of a couple of years, we've moved from little uncertainty to general consensus that this program needs to happen. I've also heard that funding's not an issue in terms of next steps. So while it may cost hundreds of thousands of dollars to stand up, there's not a funding gap for researching or meeting with Hart, McNabb, and the administration. So in my opinion, council is not needed to take the next step. We don't need to be involved and necessarily read ourselves into the play. McNabb has been doing this for 2 years. They've learned a lot. Hart has not stopped researching what they've found. What I've also heard is somewhere in there, there's a people problem where people are either being welcomed to the table or aren't talking to one another or being heard or listening well. So somewhere in there, there's a break in communication between what's next, because we've spent a lot of energy tonight dancing around the fact that we all agree that everybody, including McNabb, is open to a supplemental model that exists in addition to the co-responder model. I think there's some disagreement about whether the co-responder model needs to continue or whether this needs to be, but there is agreement on it being an additional program. And I want to thank people who spoke to me and educated me about it doesn't have to be either or. So there's broad consensus here that we need another program to fill a gap. And I think the administration, along with McNabb, who has 2 years worth of data about what they've seen, good, bad, and different, and they have a fresh perspective from other models across the nation where this is working. So council getting involved and chairing committees and having folks is not the problem. The problem is a next step where people, in addition to McNabb and the administration, are welcomed into what that could look like. And the biggest obvious practical thing is there's not anybody to deliver this. So whether it's this committee, whether it's the administration, whether it's the past 2 years, everybody can do enough research. There's enough smart people in this room to do research of what this program could look like. Nobody's willing to do it yet. So I don't want to skip past that. And us banging around for 6 months or 2 months or a year with committees and different groups is actually not a required thing to take this ball forward. We know what the ingredients are. There are people that are out there that are willing to voice into what the scope of the service looks like. The administration, as far as I've discussed, there's not a gap in funding to take the next step. Yes, we need more parties at the table, but it doesn't have to be limited to the city or the state or any individual agency. So I'm not convinced, and I've discussed this at length with the members of Hart and the administration, I'm not convinced that a task force by council is what's required. I think it makes it feel like there's a next step, but as long as this administration, which I think I've heard, is committed to continue to pursue the scope of this program, there's a willing agency that's able to take this on. I think there's a will there. So in my opinion, you can amend this resolution, you can withdraw it, you can replace it, whatever it takes. I don't think I'm going to bring anything, not that I don't want to serve on this, and not that I don't spend a lot of energy with folks who are unhoused and need help. I just don't think that city council is the answer or the expert to take this ball forward. Between McNabb, the administration, and Hart, all the experts are there. And my understanding is the funding's there to take this ball forward. So I'm kind of indifferent on whether this thing works or that thing, but picking a number and forming a committee by council just seems like it's an act of genuine frustration and fair enough, because it's been a couple years of waiting for the next step. With that said, this is a new model that we're experiencing right now. We should hear from McNabb what they're learning. They don't necessarily want to do this program, but they're willing to let someone else. And I think that's a big deal from where we started 2 years ago.
Thank you, Councilmember Smith. Councilmember Thomas?
Yes. All the points that were made at the podium were well taken, and we all want to get to the same place. It's just simply a question, not simply, because it's complicated, about how to get there. Some of the points that Councilman Smith made about how to approach this problem, I think
Councilman Thomas, can you pull your mic closer?
I can.
Thanks.
are quite good. And one of the concerns I have is how we move forward in a unified way. And what I have been hearing, also just from discussions with the community and with staff and McNabb, there seems to be not a unity between Hart and the people that are working in conjunction with the city and McNabb. Somebody's not hearing each other, somebody's not meeting together. I don't know what it is. And to paraphrase, or to use Councilman Smith's word, I think we may have a little bit of a people problem there. And we don't need to get at cross purposes. And that's one reason why I have reservations. I haven't excluded it, but I have reservations about setting up an independent group when we already have a group that's done an extensive amount of work through McNabb and have partially put in a program. So I guess I will just leave it with a question, regardless of whether we do two separate groups or unify the groups, how do we move forward with communication and unity so that we're not operating under cross purposes and that we can really have all the players in the room dealing in a real way about who's doing what and what gaps need to be addressed.
Thank you, Councilmember Thomas. Councilmember Ryder, I don't know if you or Ms. McKenzie, go ahead. Councilmember Ryder, and then Councilmember McKenzie, and then we'll go back.
Sure. I just wanted to respond to, I think Councilman Smith and Councilman Thomas just made some valid points, and I think that loops back to something Councilwoman Singh said a few moments ago. A couple other things have been brought up here tonight that have got started were like the BHUC is one of those. That was before we all got on council. I recall very much when that got put in place. The issue, those were not done with a task force. So asking questions about the task force and how it's going to work is a legitimate question, because I think the reason, as Councilman Thomas just pointed out, the ask for the task force is really a response to the frustration. I've sat down in meetings with people from Hart because nobody's saying, no, an alternative response team is not the way to go. It's just no one wants to do it. Who's supposed to figure out who's going to do it? We feel that they're asking us to figure out who's going to do it. You know what? I just got to say to you guys, I'm not saying I'm opposed, so please stop assuming that I'm against. Councilwoman Parker asked us to discuss with her. Because of Sunshine, we don't get to go have meetings with her on Zoom. So we're having the discussion because that's what she asked for, and I think that's fair. So thanks for letting us have that discussion so we can legally do it. The issue that I'm trying to get at is that a task force didn't happen in those instances because there was buy-in from the administration. And the reason, thank you, Councilwoman Parker, for agreeing with me. Sure. That's the elephant in the room we're talking about, okay? And the buy-in, I'm not trying to throw people under the bus, is a capacity issue. We asked Helen Ross McNabb to do the BHUC. We asked Helen Ross McNabb to do Impact. We asked Helen Ross McNabb to do co-responder. We ask them to do this. We ask them to do that. They're understaffed. You want to be a social worker, a clinical social worker, jobs are in abundance. Heck, if you want to be a teacher, you want to be a policeman, there's no workforce for anything apparently anymore. So we've asked them to do everything, so we got to figure out who else to ask, and that's what Hart's been going at. So all I'm just trying to say is, I don't know that the task force is going to force the buy-in. That's all. That's all I'm trying to say. I'm just being frank and blunt. And I think that's what I heard Councilman Smith say, and Councilman Thomas, is that, are we going to force the hand of buy-in from somewhere and somehow? So I just don't want to set it up for failure, that's all. I'm not saying not vote for it because I don't want to set it up for failure. I'm just being frank and saying out loud what you didn't say. Is that fair enough? No? I don't want to put words in your mouth.
Well, I just don't see the process as a means to force an outcome. I really don't want to set it up that way.
Okay.
But I think, and also, you know, from council members and the administration, I've heard a lot of positivity, but also a lot of questions. And so if there is a lot of positivity and a lot of questions, my hope would be that the task force provides a space to help create some clarity. Whereas we've spent another hour again trying to get some clarity, and we're just not going to get clarity in this space. There's too many too many questions to answer, too many reports to make sure we've all read and we're all on the same page on. So that's really why I'm pushing for the task force, not because I think it will force an outcome, but because I think it will create space. It will allow those of us on council who want to help take the lead on this to get involved, help take the lead, and recognize that there is limited capacity in the administration. Recognize that there are a lot of asks being made right now of our city that, coming out of the pandemic, we have stood up new programs that need attention and support. But this is a space where council can help move the ball forward, just like we have done through workshop spaces and other things, because ultimately, this is going to have to come back before us for approval, to form it, to fund it. So I think it makes sense for us to form a task force around this issue.
Councilmember McKenzie.
Thank you, Mayor. I'd like to ask Ms. Riffwile if you could come back to the podium. I have a couple of questions, please. Thank you, and my apologies that I did not get an opportunity to meet with you guys before this came on to, before council. But just reviewing HEART and the website, it looks like HEART has been doing some research
Yes.
these last 2 to 3 years around this topic and have been advocating.
Absolutely.
Have you all had the opportunity to sit down with the chief, with the people who are currently involved with the co-responder team that's set up in KPD or with Helen Ross McNabb, some of the programs that are already out there that we're hearing folks talk about, like BHUG? Have you all had that opportunity to sit down with them and gather their data and just talk a little bit about some of the challenges that they're experiencing?
We've had incredible opportunity to sit down with Chief Noel, who was incredibly supportive of our proposal. We tried to give him our full spiel, and he was like, "Stop, I'm on board," just immediately. So I encourage each of you to reach out to Chief Noel and ask him about how he feels about this program. We have not reached out to Helen Ross McNabb, honestly, about the co-response program because our values do not align with the co-response program. So while we're open, and I think the task force would be a great time to do that, just our values do not align with police response at this time for mental health crises. So no, we have not sat down with them.
And what about Cherokee? Have you guys had any conversations with Cherokee? I know that they...
We've sent a lot of emails to a lot of different folks about meeting with us, and it's often we don't get responses because we are just a small volunteer group. We don't have funding. We don't have government backing or support. So it's kind of like a shot in the dark when we reach out. So that's what I feel the task force really accomplishes, is it allows these people that are very busy with their own missions to come and, get on this task force and accomplish this.
Right. And so knowing that the ultimate goal is to establish an alternative response team that will be able to full service meet the needs, to identify all of the resources that are available, because again, if you go out on a call and this person needs to be placed somewhere and there's nowhere to place them, this is why I talk about the joint venture and that people are coming to the table. By no means am I saying we're going to call the state and ask them to respond to a call or anything like that, but do we need the state to be saying, yes, they're willing to put money into this city and to help expand existing services, or as the mayor talked about, having some beds somewhere and being able to expand on those beds. We know, again, that we have limited resources. We have more people who need help than we have resources. And again, this is why, unfortunately, a lot of people land in Knox County Jail, which is where they do not belong, of all places. And so with that said, does HART already have a proposal as it relates to, hey, this is what we would, if you had it today, if you could turn in a proposal today, you all have it built out as to, everything that you would need? I saw that you do have, you've done some research on days of the week, the hours from other cities that have these types of co-responder teams where they feel are those hours where you would need staffing. And so how many teams would you all be looking at, just based on the numbers that you've seen and you've gathered locally?
Sure. Just to address the first part, you'd mentioned, the big question that I hear from a lot of city council members, which I think is very legitimate, is where do these people go when we go to the calls? And I think what's missing on that question is just the concept of de-escalation. For a lot of these folks, they're not willing to go to services. Maybe they've had a really bad experience with getting mental health services, but there is a way to de-escalate them and prevent harm from a police officer showing up on the scene. So it's not necessarily, let's go fix this person's life forever. It's how can we prevent harm and how can we do what's best for this person, which might be just stabilizing them on the scene, creating a relationship with them where they know us and we can provide that service. And another example that I love to give is, one of our members, Amelia James, she does de-escalation workshops for businesses. And they always say, who can we call? They don't want to call police. But say, for example, someone walks in a restaurant and is acting erratically and not leaving, they could call and request Knoxville HART. They would come. They have the de-escalation skills to get that person out of the restaurant. Maybe they don't want to go on to further services, but we could prevent that escalation in that situation. So your second question was about, do we have a proposal? Yes, we have a proposal that we've worked on. It's $400,000, and it funds 3 employees and a van and a bunch of other startup costs. It also includes a medical supervisor, which will be necessary if we have a medic on the team, and a outfitted van and consultation from Cahoots in Denver Star. So that's $400,000 for a 1-year pilot program, and it would be 1 van. So our data would be limited. We likely would start in one area of the city so that we could really focus in and track that data. And I'm sorry, what was your third question?
That third question myself.
I was trying to keep track.
Right, no. My time is up, so, okay, thank you.
I'll see
Thank
a
you.
couple other people's lights on. Councilmember Smith?
Thank you, Mayor. I would just. Sure.
Okay.
I don't really have a question, just more of a, it's, we've talked, I think, a little bit about, some of this comes from not feeling like you have a place at the table. And so even though you may disagree, this is my just ask of you, is even though you may disagree with the co-responder model fundamentally because it has a police officer in there, they're still seeing hundreds of folks. And so there's got to be some things that can be learned that would inspire or inform your program, because I think it's a very important when you ask to be heard to also listen, because the existing provider doesn't agree with all the things that you're going to recommend. And so I think this is part of the challenge. We all have to kind of open our ears and hear one another. And if you want to speak to McNabb, I'm sure there's 10 people here that can connect you to it.
Yeah.
They're going to tell you something that you didn't know. They're going to tell you something you disagree with. But
I completely agree, and it's something that we need to do. And to be honest with you, our capacity is very limited. We've been doing this for 3 years, so as we grow our capacity, I hope that we can have more conversations with more people.
Right on.
So I completely agree with that.
Thanks.
Thank you.
Councilmember Testerman?
Thank you. Ms. Riffwald, I'm just curious, so the city orchestrated a workshop, the SIMS workshop, in partnership with McNabb. Were you all there?
We had a member there, but she was representing her employer, so she cannot speak to HART at that time. And the other members were unfortunately able to attend because it was during the workday and they couldn't take time off.
Okay, so.
But we have seen that data.
Okay, so it wasn't, as you just mentioned, as far as McNabb and their participation in the co-responder, that wasn't a catalyst for not participating?
Oh, no, it was purely, we have therapists on our roll who have full days of sessions. We just cannot make it work during the workday. But we did have someone there who has told us how it went. They just couldn't speak on Hart's behalf because they were there for their employer.
Okay. Deputy Mayor Gill, would you mind expanding a little bit as far as the results of that workshop and just doing a little more of a deep dive on it?
Certainly, and this is a summary based on the final report, which I know we shared with council as part of your budget hearings earlier this month. So the strategic intercept mapping workshop did openly talk about alternative response. The process, when you lay it all out, and again, you can read the report, that did not identify alternative response as a key need, but it did validate co-response. And in several parts of the report, you talk about, to Councilwoman McKenzie's point, where you go next. And so discussions around the need for case management, for example, I think as your resolution points out, it discusses kind of the gaps that we have in our community around housing, around transportation. So it did think about the ways that we already have new types of resources, such as the BHUC or the empath unit, to respond to the needs of people with behavioral or mental health disorders. It did identify the need to expand and strengthen co-response, not just within KPD, but also within other jurisdictions that serve our community, for example, UTPD, the Sheriff's Office. It supported the empath unit and the need for additional treatment facilities in real time to help people get access to mental health resources more quickly, but it did not recommend pursuit of the alternative response model at this time. Again, not undermining the value of the system, but just kind of ranking it in the general prioritization as something that would fall below the co-response program and making sure that that is prioritized.
Vice Mayor Roberto?
Thank you, Mayor. You know, what I've heard in this discussion is support for this model, support from the administration, support from council. There was a word that Council Member Thomas said just a little bit ago when he was discussing this, and he said the word unity. And I think there's an actual opportunity here to leave today with unanimous support for this model, but from the discussion, it's very clear that some amendments are going to have to be made in order to do that. You know, we haven't had a motion yet at all on this. We've had a lot of good discussion. I'm glad we have. You know, but I think we're at a point where we need to decide what we're going to do here. And you know, I didn't bring the resolution, so I'm not going to propose any amendments. But I think it's pretty clear from the discussion what those amendments would be. I'd be willing to support that if we did that, but that's up to Councilmember Parker because she brought the resolution. But I do think it's time to move on.
Councilmember Parker?
Sorry, excuse me. I agree, Vice Mayor Roberto. I think we've had a really healthy discussion tonight, and I really appreciate everyone's willingness to engage in that discussion and weigh in and give us some clarity of where you stand at the moment on this issue. There's certainly a lot of support around the table, but it sounds like the resolution could use a little more work. So one thing I would like to do is make a motion to postpone the resolution until our June 27th meeting, allowing council members time to engage with community members, lift up the amendments that they would like to see in order to support it. And let's see if we can come back in 4 weeks and walk away with a unanimous vote in favor of forming a task force.
I'll second that motion to postpone to July 22nd.
Motion made to postpone.
June 22nd, I'm sorry.
Motion made by Ms. Parker, seconded by Vice Mayor Roberto to postpone this item until June 27th. Any questions or discussion? Seeing none, all those in favor, please say aye.
Aye.
Any opposed? Motion carries. Council members, let's take a little break to use the bathroom or whatever. We'll reconvene at 8:43.
Literally solving.
Council members, it's 8:43, 10 minutes after, oh, now it's 11 minutes, so let's see, we got 1, 2, 3, 4, 5 members present, 6. Let's go ahead and reconvene this meeting and move forward with the rest of the agenda. Next item is D.
11D is a resolution expressing appreciation to Knoxville's Community Development Corporation for the donation of property located at 0 Texas Avenue and authorizing the mayor to execute all documents necessary to accept said donation.
5th District. Move to approve.
Second.
Motion made to approve and seconded. Any questions or discussion? Seeing none, all those in favor, please say aye.
Aye.
Any opposed? Motion carries.
Sorry. 11E is a resolution authorizing the mayor to execute an agreement with Davis H. Elliott Construction Company Incorporated for on-call services for traffic signal detector loops for an annual amount not to exceed $45,000 for a one-year term with 2 optional one-year renewal terms.
Move to approve.
Motion made to approve and seconded. Any questions or discussion? Seeing none, all those in favor, please say aye.
Aye.
Any opposed? Motion carries.
11F is a resolution authorizing the mayor to execute an agreement with Integrated Response System LLC for on-call services for traffic signal detector loops for an annual amount not to exceed $45,000 for a one-year term with 2 optional one-year renewal terms.
Move to approve.
Second.
Motion made to approve and seconded. Any questions or discussion? Seeing none, all those in favor, please say aye.
Aye.
Any opposed? Motion carries.
11G is a resolution authorizing the mayor to execute an agreement with Seed Incorporated to provide an amount not to exceed $50,000 in community development block grant funding to support its green construction program.
Move to approve.
Second.
Motion made to approve and seconded. Any questions or discussion? Seeing none, all those in favor, please say aye.
Aye.
Any opposed? Motion carries.
11H is a resolution authorizing the mayor to execute an agreement with Connect Ministries to provide an amount not to exceed $37,000 in community development block grant funding for workforce case management and transportation service to approximately 35 individuals through the Good Neighbors Program.
Move to approve.
Second.
Motion made to approve and seconded. Any questions or discussion? Seeing none, all those in favor, please say yes.
Yes.
Any opposed? Motion carries.
11I is a resolution authorizing the mayor to execute an agreement with Neighborhood Housing Incorporated to provide an amount not to exceed $162,687 in community development block grant funding to support its workforce development program.
Move to approve.
Second.
Motion made to approve and seconded. Any questions or discussion? Seeing none, all those in favor, please say aye.
Aye.
Any opposed? Motion carries.
11J is a resolution authorizing the mayor to execute an agreement with Neighborhood Housing Incorporated to provide an amount not to exceed $325,000 in community development block grant funding to support Operation Backyard, its minor home repair program.
Move to approve.
Motion made to approve and seconded. Any questions or discussion? Seeing none, all those in favor, please say aye.
Aye.
Any opposed? Motion carries.
11K is a resolution authorizing the mayor to execute any and all documents necessary to apply for and accept a grant award from the U.S. Department of Justice Office of Justice Programs Patrick Leahy Bulletproof Vest Partnership Grant Award of $44,800 over a 2-year term or period with a required 50% local match for a total amount of $89,600 to provide funding for the purchase of bullet-resistant vests for the Knoxville law enforcement officers.
Move to approve.
Second.
Motion made to approve and seconded. Any questions or discussion? Seeing none, all those in favor, please say aye.
Aye.
Any opposed? Motion carries.
11L is a resolution authorizing the mayor to execute an agreement with Keep Knoxville Beautiful Incorporated to provide litter prevention, litter collection, graffiti removal services, and awareness and education efforts throughout the city of Knoxville for an amount not to exceed $100,000 annually.
Move to approve.
Motion made to approve and seconded. Council members, I just want to say that, like you, one of the most frequent complaints I get about issues in Knoxville has to do with litter. And we've heard loud and clear those concerns. Our public service crews have done a stellar job doing what they can, but, and we've also, as you know, expanded our mowing crews to clean up litter in the winter. And later this agenda is an item to continue river cleanup with IAMS. But Keep Knoxville Beautiful, this is an expanded connection and resources for them that they're going to continue doing additional litter patrols and go hand in hand with some of our existing efforts. And this will also help keep Knoxville a clean and welcoming city. So I'm excited about this expansion of their services. I think the community will really appreciate having less litter in our community. And hopefully, you know, the biggest way is to have a litter-free community is just not to throw down on K-Town in the first place. So hopefully this will turn that around a little bit. Any questions or discussion? Councilmember Singh?
Thank you, Mayor. Are we still using inmate labor for litter pickup and other projects?
Mr. Brace?
No, we've not been able to utilize that. Unfortunately, it's been, we've missed that service. It's been really important to handle many cleanups, especially cleanups within our creeks. Really, COVID ended that program and the ability to obtain those services.
Well, then this sounds like a good decision to move forward.
Thank you. Any other questions? Seeing none, all those in favor, please say aye.
Aye.
Any opposed? Motion carries.
11M is a resolution authorizing the mayor to amend an agreement with Clean Earth Alabama Incorporated to increase the cost to provide transportation and disposal services for the hazardous wastes collected through the joint city-county household hazardous waste collection program for an estimated amount of $56,664.57 annually, plus collection of batteries and DOT transportation containers at an estimated cost of $10,000 annually.
Move to approve.
Second.
Motion made to approve and seconded. Councilmember Ryder.
Yeah, I don't know if Mr. Weth is still here or someone from his team, but.
Mr. Weth is here.
Get to run up. I guess my question is more of a comment. I'm curious how much the volume is, because honestly, I think this number is, I know it's an increase, but I think it's pretty decent sounding of a number considering.
Are you asking the volume? Oh, sorry, Chad
Yeah,
Weth,
like,
City
what's the
Public Service
volume?
Director.
Like, how much of the content that comes in through the transfer station falls into this?
I'd have to get you the exact numbers on how much. I mean, you know, they take anything from motor oil to aerosol cans to oil-based paints to, again, batteries. So I'd have to get you the exact number on each material if that's what you're asking.
I'm curious how we compare to other cities. I just think that sounds like a very reasonable amount of money.
Yeah, so only 4 cities, the big 4 cities in Tennessee, have a dedicated household hazardous waste facility. So I should say a permitted facility. There's other ones that will take certain products, but not as many products as we do. So I'll say over the years, we've been a model for the other cities of how to run it. So I've not visited all of them. I've only visited a few of them, but we do very well compared to them.
And people have to show their ID, right? They have to be city residents, or we take from outside?
They do. This past year, the state actually funded a little bit of, the facility is funded through the city and the county and the state. Part of the state funding was depending on us taking it from anywhere. Okay. So you do have to be a resident, but even if you are just outside of Knoxville, you can still take it there now.
Okay, all right, thank you.
Yes.
Thank you, Mr. Weth. Any other questions or comments? Seeing none, all those in favor, please say aye.
Aye.
Any opposed? Motion carries.
11N is a resolution authorizing the mayor to amend and extend an agreement with Waste Connections of Tennessee Incorporated for the collection of all household garbage and recycling materials with the city of Knoxville for an estimated amount of $468,000 annually.
Second.
Motion made to approve and seconded. Any questions or discussion? Seeing none, all those in favor, please say aye.
Aye.
Any opposed? Motion carries.
11O is a resolution authorizing the mayor to execute an agreement with IAMS Nature Center to provide trash and debris removal services for the waterways from forks of the river to the end of Sequoia Park for an amount not to exceed $50,000 annually.
Move to approve?
Second.
Motion made to approve and seconded. Any questions or discussion? Seeing none, all those in favor, please say aye.
Aye.
Any opposed? Motion carries.
11P is a resolution authorizing the mayor to execute any and all documents necessary to apply for and, if awarded, accept an energy efficiency and conservation block grant from the United States Department of Energy in the amount of $239,720 with no local match required to develop various energy-efficient strategies through projects to build a clean and equitable energy economy for the community.
Move to approve.
Second.
Motion made to approve and seconded. Any questions or discussion? Seeing none, all those in favor, please say aye.
Aye.
Any opposed? Motion carries.
11Q is a resolution authorizing the mayor to execute an agreement with True Grip and Lighting Incorporated to provide the stage, lighting, and production equipment and labor for the festival on the 4th in an annual amount not to exceed $61,196, with the option to extend the agreement to include festival on the 4th events in 2024 and 2025.
Move to approve.
Second.
Motion made to approve and seconded. Any questions or discussion? Seeing none, all those in favor, please say aye.
Aye.
Any opposed? Motion carries.
12A is an ordinance to amend Chapter 2, Article 2, and Chapter 6, Article 6, Sections 6-137, 6-140, 6-145, 6-152, 6-153, and Article 7, Section 6-181, and Chapter 13, Article 1, Sections 13-5, and Article 4, Sections 13-15, 13-145, 13-146, 13-147, and 13-148 of the Knoxville City Code to reflect the transfer of duties from the Director of Plans Review and Building Inspections to the Director of Public Service and amend the definitions of codes official and Director of Public Service and Director of Plans Review and Building Inspections.
Move to approve.
Second.
Motion made to approve and seconded. I just want to thank Mr. Weth. Where did you go back there for agreeing to take this back into your department? You all do amazing work, and I'm confident that you'll do a great job on this responsibility as well. Thank you. Any questions or comments? Seeing none, all those in favor, please say aye.
Aye.
Any opposed? Motion carries.
12B is an ordinance to amend and adopt the fiscal years 2024-2029 Knoxville Capital Improvements Program, including the fiscal year 2024 capital improvements budget. City of Knoxville applicant, all districts.
Second.
Motion made to approve and seconded. Any questions or discussion? Seeing none, all those in favor, please say aye.
Aye.
Any opposed?
No.
Motion carries. Public forum, we have a few people signed up for public forum. First is Maricino Jones. Ms. Jones, if you could start by saying your name and address for the record, you'll have up to 5 minutes.
Yes, ma'am. My name is Maricino Jones, 792 Lula Powell Drive, Knoxville, Tennessee, 37915. And I am actually returning to ask you a lovely question, Miss Mayor. Did you find out what City Code had to say about my issue? Was there any update or follow-up with that? Because you know what, from the look on your face, no ma'am, you did not. Even though I had already done it, and that was your response to me at the previous meeting we had, guess what? Still an issue. And I actually stood here tonight and listened to a service that could really be beneficial for me, considering the fact that it still sounds like I have the airport landing on top of my roof every single day. Now, the reason why I came back to see you today was not just to give you my beautiful face or my boastful voice. It is to, again, ask you, why did you refer me to a place that I had already spoken on, which is City Code, the last time, even made a very valid point of a home burning down that I had previously reported to City Code that allowed another family to move in and lose all of their stuff? Why did you refer me to someone who doesn't care? Is it because they're just like you? Is it because they actually have the authority to sit there, have a smirk on their face, and just say, oh, we'll refer you to City Code and find out how that turns out? Did you do your research? Because it's still an issue. You want to know how my apartment complex talks to me, who is a multi-corporation running this place? Oh, well, you know, 3 years ago, I hung myself over the edge of the building, which is what my maintenance man told me. Ironically, I've been there for 4 years, only reported this problem as of last year. So unless he was either A, psychic, or B, flat out telling me a lie to pacify me, as if I'm a 22-year-old or an 18-year-old. Like I didn't know the day that I did my walkthrough of my apartment if that noise was previously there or not. So yeah, Miss Ma'am, what are we gonna do about this issue? Because I still can't sleep at night. Guess who literally had to break down because as we just sat here and talked about the Hearts program and literally had to contact Miss Constance Every in the middle of the night because guess what? I can't take it anymore. My head hurts. I'm now taking more Motrin than a doctor will even recommend me to take because of gasping headaches as soon as I walk through my door. I am giving money to an apartment complex to be able to enjoy my balcony, and I can't do that. Why? Is what I hear as metal is rubbing against metal from my front door to my bedroom. I am a prisoner in my own apartment. I have nowhere else to go. Why? Let's see here, we've already talked about homelessness, we've already talked about mental, oh, that's right. If I was to call right now and tell them exactly how I was feeling, you know where I would go? Moccasin bin. Instead of us addressing the issue, and my issue is why are these corporations allowed to get away with it? I keep hearing about funding. You guys just raised taxes. But yet this big time corporation has no punishment whatsoever. We're literally gonna sit here and play it off like, oh, I've just lost my mind and decide to complain about this out of nowhere? Or are we actually gonna do something about it? Because from what I've heard in this meeting so far, the proper communication that's being lost is sitting right here at this board. You literally had staff, authorized staff, that could be helping me right now, this very moment, because none of you guys are doing it except for Ms. Parker. Thank you so much for funding that program. Thank you so much for backing that program. And I pray to God that when you guys are done, your voice is actually heard because you are the only one that is actually taking, excuse me, ma'am, I could have swore you just had a teacher, a retired teacher. And that's what lets me know you don't care about anything I had to say prior to this and what I have to say now. Because every time I'm talking to you, I'm looking directly at you. And she just broke that down earlier in the meeting. So with that being said, you will be seeing me again until my problem is resolved. Because it's a problem. It's a mental problem. It's a building nuisance problem. And it's something you need to have done before you leave this office, is to make sure your citizens are heard.
5 minutes. Your 5 minutes are up. Thank you very much. Next person signed up to speak is Tina Sparks. Ms. Sparks, is she still present?
I think she left. Also, Nikki left.
Okay. I don't see anyone named Nikki anyways, but.
Oh.
That concludes public forum. Council, without objection, this meeting is adjourned.